I was born in Chicago. I grew up there. My father was a Chicago policeman. I have 7 brothers and sisters, a good Irish Catholic family. I kind of wanted to get out of the big city atmosphere, and the crime was pretty prevalent in Chicago, and I wanted a safer place to raise the kids. I wanted to get out of the concrete jungle and give them an area where they had some space to grow up. So we moved to a small rural farm town basically. Started a small business and raised my kids there. I'm pretty active. I work out at the Y. I was lifting weights and I dropped a bar on my chest. And I woke up the next morning and I thought I had a bruise because it hurt. And when I felt it, I felt a lump, which I wasn't really concerned about because I had a mammogram 3 weeks before and it came out fine, which I've never had, a bad mammogram or anything. There's no breast cancer in my family, and I've never taken any medication, never had any surgeries. I just happened to have a doctor's appointment that week for my yearly checkup, and the doctor said, let's do an ultrasound. I'm not sure. So I'm like, okay, fine. So we do the ultrasound, and they said, let's do a biopsy. I'm not sure. And the whole time I thought, it's just a bruise. So they did the biopsy, and it came back invasive ductal carcinoma. So it took me a little while to digest it. I did a lot of research, a ton of research. When I talked to the doctor, she said, do you have a surgeon? I'm like, no. I've never had any illnesses or sicknesses or anything. So I just started researching again. Came up with Ellis Fischel and called them, and they got me in within just a couple of days. I mean, I met Dr. Nelson and her nurse Cassie, which they were beyond awesome. They talked to me on a level that was not above me or below me. They explained things to me, and I'm sure, after going through this whole thing, I'm sure they get those same type of questions over and over again from patients, but they never made me feel like I was just a patient, that I was important, that my questions were important, So I think I've got a really strong relationship with both of them. I guess I just went into survivor mode. When I moved here, I had no grandchildren. I now have 3 baby granddaughters. And my first thought was, oh my God, if I die, they won't remember me because they're too young. And that just devastated me. So I thought, it's not going to happen. I'm strong, and I'll just get through it. I'll do what I have to do, and I'll get through it. Honestly, the hardest part was to tell my kids, because both my kids live in Illinois. I knew it would devastate them. I knew they would have that feeling of helplessness being so far away, and I was their rock. But they acted like adults. They stood up and took it well, and they were there for me. And I think part of what helped me a lot too is I actually was very physically fit and in very good health. I had no problems at all. I worked out 3-4 nights a week. I love cross-boxing. So I think that's where the word warrior came from. That was in my mind, that's what I was going to be. I was going to be a warrior, and I was going to just fight it. My first bit of advice would be to take help when people offer it. The people that I wouldn't even imagine when they found out just came out of the woodwork and offered help and sent cards and sent meals. And it's, women that are my age or around my age that are mothers or grandmothers, they're so used to doing for others and giving to others. It's very hard to sit back and have somebody clean your house or somebody buy your groceries, because it's all the things you've always done for yourself. So I would say take that help. Let those people in and help you. I've been cancer-free for a year now, a little over a year. I think one thing that was really hard for me is when it was done and over. People, I think when you take your last chemo treatment, they're like, next week you're going to be normal again. And believe me, life is not normal after cancer. It's better in some ways. At least it has been for me. But I expect, it changes. All those people that were there kind of fade back into their lives and stuff, and you live for a year and a half with just an appointment book of doctor appointment after doctor appointment after doctor appointment, and then all of a sudden you look at the calendar and there's nothing to do. There's no more doctor's appointments, and you form these relationships with the people in the medical field or the people that you've seen, and you don't get to see them anymore. So, I mean, that was kind of a rude awakening for me a little bit. But I guess, again, my advice is just there's so many people out there that have either gone through what you're going through, or there's organizations out there that can help you. Reach out to them. They are absolutely amazing. Find a sister to talk to, a sister in pink.